The next bill on the calendar for the day is House File 13. The clerk will report the bill.
House File number 13, number 1 on the calendar for the day, an act relating to child care assistance, the second engrossment.
I recognize the author of the bill, the member from Ramsey, to explain the bill. Representative Pinto.
Thank you, Mr. Speaker. So this is the second half of our Great Start Day. I'm grateful to members for their support of the portion of our work that gets us to July 1. Members, House File 13 would meet really an implied promise that the state made a long time ago in participating in the federal program, the Child Care Development Fund. In our state, it's called the Child Care Assistance Program. To have the rates for that program be set at the 75th percentile of the market rate survey. This is a survey that's taken every 3 years. And what HF 13 would do would be to simply set our rates at the level that they've supposed to be for years. It would also reprioritize the waiting list that counties use to make that list more efficient and make sure that kids and families are getting the care that they need, and counties have the confidence for doing that. And there are some measures relating to integrity of programs at DHS. I suspect we'll have some conversations about that, so I may not get into a ton of detail, except for simply noting that it will provide DHS with additional authority that is needed to end payments to providers who've been found. Thank you, Mr. Speaker. Ending payments to providers who've been found has been excluded from other state programs under either state agencies or federal programs. So additional powers to the Commissioner to do that. Members, HF 13, as I said, gets our rates up to where they're supposed to be in terms of payments. These are for low-income families getting child care and early learning, and we want to make sure that those rates are as they need to be to give families the maximum choice and opportunity. And this is so that parents can work and so that employers can expand. We can deal with the worker shortages we're seeing in all the sectors that we all care about, which really have child care at the base. The child care workforce is, in fact, the workforce behind the workforce. I look forward to a conversation, and thank you, Mr. Speaker.
Members, there is an amendment at the desk. The clerk will report the amendment.
Daniels moves to amend House File number 13, the second engrossment. The amendment is coded A12.
I recognize the author of the amendment, the member from Rice, Representative Daniels, to explain the A12 amendment.
Thank you, Mr. Speaker. I'm hoping this will be a friendly amendment to the bill author. This amendment would require implementation of centralized provider registration system for child care assistance program, including electronic recorded system for CCAP reimbursements. The electronic payment system would use non-biometric methods for identification and work with the commercial available systems to provide providers might be already using. The cost of this developing the system would be covered by the appropriation in the bill and to require the new system to be placed prior to the CCAP rates. And I'm hoping that the bill, the author, Representative Pinto, would find this as a friendly amendment.
Any discussion to the amendment? I recognize the member from Ramsey, Representative Pinto.
Thank you, Mr. Speaker. Representative Daniels, thanks for this, for bringing this forward. It's an intriguing idea, and I would love to work with it, work with you on exploring it. I might ask, will Representative Daniels yield to a question, Mr. Speaker?
He will yield to a question, Representative Pinto.
If I can ask Representative Daniels whether he has introduced this as a bill or whether he's aware of it being introduced. I don't believe that it has been in my time chairing the committees that oversee this area.
I recognize the member from Rice, Representative Daniels.
Thank you, Mr. Speaker. Thank you, Chair Pinto. I don't believe there has been a bill on this, but then again, the rate that these bills are moving through committees and onto the House floor has been pretty rapid. In my, well, you and I came in the same year, so 9 years we've been serving. This is pretty fast-paced, but I would ask you for just consideration on accepting this amendment, even though there hasn't been a bill introduced previously. Thank you. Thank you, Mr. Chair.
Representative Pinto.
Thank you, Mr. Speaker. Representative Daniels, thank you. And I know, I suspect that Chair Pulowski would not disagree that we seem to not have any trouble in this chamber introducing bills this this year at a quite rapid pace. I will commit to you, Representative Daniels, that you or any member who introduces this, I would be very happy to give it a hearing. I do think it's something to look at. I will note that as this has been explored, when I've heard about it through the years, there's been some concern for providers, and we've had a lot of talk about burden of regulations for providers. There's been some mixed thoughts on that. I think about half of providers have electronic systems at this point, but the question is kind of how it interfaces. So in any case, not prepared to move forward with this at this time, but certainly happy to work with you, especially if you'd be interested in introducing as a bill or another member would. And so I would urge members respectfully to vote against this. Thank you.
Any further discussion to the amendment? All those in favor of the amendment, please say aye. Aye. Those opposed, please say no. No. The motion does not prevail and the amendment is not adopted. There are no further amendments at the desk. The clerk will give the bill its third reading.
Third reading, House File number 13.
Third reading. Discussion to the bill. I recognize the member from Douglas, Representative Franzen.
Thank you, Mr. Speaker and members. Here I am again talking about childcare, something that I did once many, many moons ago. And, members, I'm actually very surprised we're in third reading already, so it's kind of exciting. A lot has been said about this industry over the last two bills now, and I know, I'm sure we've got lots of advocates wondering how we're going to vote on this bill. When I did childcare, as I stated, I started off with my son was 18 months, and then I had my newborn Colin, so I had Carl and Colin, in my own business. And did you know that when you do licensed childcare, those numbers count against you? So when I started off, I think my license, I could take a total of 8 kids, and then there was a breakdown, and that was for a year. I think it was a Class A. And 2 of those spots were taken up by my 2 boys. And this is for every licensed family childcare provider. Their spots go to their kids. Is it fair? I don't know. Is it not fair? One of the benefits that I saw personally doing the business was that I got to be home with my 2 boys and instill the values I wanted them to be instilled with, and had a wonderful experience doing that. However, centers are treated much differently. I have this list here of, I think it's 224 providers thus far that I pulled off, 224 centers that are authorized to receive CCAP for up to 25 children of their employees. So if I was an employee of a child care center and I wanted to bring my children to work with me, that was fine. So CCAP pays parents to take care of their own children. There's no subsidy for home child care providers who take care of their own children. And those children also count against their own ratios. And so for funsies, I started going through the names on this list and looking up their license to see if they were stellar providers. By stellar providers, I mean minor infractions like we hear from the home child care providers, like they left a bobby pin out and they got written up for that, or They left their toothbrush on the counter. They got written up for that. Minor infractions, right? Woofda, I'm telling you. Off this list, I was pretty shocked at the long list of violations that these centers have. Where am I going with this? Members, there is an unfair advantage to centers when it comes to the ratios, something that this body needs to think of. Also, CCAP reimbursement rate increase. I think we can all say, you know what, those rates probably should be increased because of inflation. A lot of inflation, we're all seeing that. The Biden walls in inflation has not been good to Minnesotans. It has not been good to Americans. However, when this body does not take the fraud seriously, when we continue to allow fraud walk out the door and say, oops, we did it again, guess we'll have to try something else. Taxpayers say to us, what are you doing down there? What are you doing down there? This bill, in my humble opinion, will continue to feed the fraud program that we have. Because we have not taken seriously the issues that have plagued this program for years. So members, today I will be voting no on House File 13.
I recognize the member from Rice, Representative Daniels.
Thank you, Mr. Speaker and members. I'm going to make a motion to re-refer this to the Children and Families Committees. When this bill was in Children and Families, Republican concerns regarding rampant CCAP fraud and the links to Feeding Our Future were dismissed. Our committee never received, reviewed, or discussed half-heartedly integrity measures added to this bill in Ways and Means. Before this bill passed by the House, the Children and Families Committee should review the new language in this bill and determine if there was meaningful measures included. So therefore, Mr. Speaker, I move to refer House File 13 to Children and Families Policy and Finance Committee, and I request a roll call.
Representative Daniels requests a roll call vote. Seeing 15 hands, there will be a roll call vote on the motion to re-refer. Is there any discussion to the Daniels motion to re-refer House File 13? I recognize the member from Ramsey, Representative Pinto, to the motion.
Yeah, thank you, Mr. Speaker. Representative Daniels, I'm assuming, I guess maybe I should just verify this if I can, if Representative Daniels will yield, Mr. Speaker. Will Representative Daniels yield to a question, Mr. Speaker?
Representative Daniels, will you yield for a question? He will yield for a question. Representative Pinto.
Representative Daniels, I just want to make sure I understand the basis for your motion. It has to do with the language starting on page 4 regarding limits on receiving public funds. I just want to make sure that I'm understanding kind of what the concerns are, or that's what you're talking about.
I recognize the member from Rice, Representative Daniels.
Thank you, Mr. Speaker. Thank you, Chair Pinto. It's regarding the language that was changed in Ways and Means, and just concerning that the language changed after we heard it in Children and Families, and now we're going to pass the bill. So I'd really appreciate if we could re-refer it, hear the new language, talk about the issues that have happened. Everybody's got the data on how much expected fraud there's been over the years. There's still, by the Inspector General, there's still 40-plus investigations going on CCAP. When I asked in committee, and you were present, I believe, I asked them specifically, they said the $100 million was not possible in fraud. And so I asked the Inspector General, well, give me a number. Is it 10 million? Is it 30 million? Is it, what it is? And she could not give me an answer. And if you remember, at that time, I asked for how many ongoing investigations there were ongoing, and she couldn't answer that, but about 2 hours later, I got an email from her saying that there was 40 ongoing investigations. So with the new language, I'd really appreciate if we could bring it back to the committee and go over the language and kind of start this thing over again. Thank you.
Representative Pinto.
Thank you, Mr. Speaker. Thank you, Representative Daniels. So I guess this does give me a greater chance to highlight that language. I mean, I know I've heard from members on your side of the aisle and members in general concerns about making sure that the DHS commissioner has the authority to exclude from programs those individuals who may have been excluded in other programs. So that's what this language is about. I understand it's a little bit unusual to have added it later, but the concern is we want to make sure to move just as quickly as possible so that we make sure to cut off if somebody is doing wrong. We want to make sure to cut off as quickly as possible on what they're doing. So the language is pretty simple, Representative Daniels. I'd ask members to vote against the motion, and as you'll see in the language here, what it does is says that if somebody is prohibited in some other from participation in some other state or federal program, we want to make sure the commissioner has the power to cut them off in DHS as well. I feel like I hear a real sense of urgency from that among your members. I understand it. It's shared on this side of the aisle, and that's why I'm moving forward with it right now. I think we should pass this and get this language going as quickly as we can. Thank you, Mr. Speaker.
Is there any further discussion to the motion? Members, before I instruct the clerk to take the roll, I will remind us that we are voting on Representative Daniels' motion that House File 13 be re-referred to the Committee on Children and Families, Finance and Policy. Seeing no further discussion, the clerk will take the roll. Would the clerk please call the name of the member who is voting remotely?
Agbaje.
Agbaje votes no.
Agbaje votes no.
The clerk will close the roll. There being 59 ayes and 70 nays, the motion does not prevail. Members, we are back to discussion after third reading of House File number 13. I recognize the member from Chisago, Representative Neu Brindley.
Thank you, Mr. Speaker. And members, as I was looking at this, you know, this bill is based on this rate survey that's done every 3 years with child care providers. And we adjust the rates periodically. Last time they were adjusted, we bumped them up from 25%, or the 25th percentile, to the 30th and 40th percentile. And now, with this bill, we are increasing that to a whopping 75th percentile. This is a massive increase. And of course, the problem here is that after all these years, we still have not gotten answers and have had resolution to the issue of fraud in the system. And I know our Democrat friends like to tell us, no, it's fine, it's fine, it's fine. Well, there is literally nothing that tells us that it's fine. Nothing. And in fact, when the real bombshell of the CCAP fraud came out a few years ago, we were told that it was about $100 million in fraud. $100 million went out the door in fraudulent payments. Now, that number is alarming in and of itself, but you know, the total number that was appropriated for CCAP at the time was $240 million. That means 40% of what we appropriated as a legislature went out the door in fraud. 40%. And these issues have not been resolved since then. And now, rather than ensuring that the money we spend to take care of our kids is spent on taking care of our kids, it's just like the last bill. We're just going to throw some more money in it. We're just going to throw some more money. We're going to increase these rates. We're not going to bother to know that these dollars are being spent where they're supposed to be spent. We're not going to hold folks accountable to ensure that when we do find fraud, there is accountability, because you know what? $100 million, zero accountability. None. $100 million. 40%, 40% of the money intended to take care of our kids went out the door in fraud. And yet, instead of fixing the problems, again, as is our habit here in the legislature, instead of fixing the problems, we just put more money in. More money. That'll solve the problem for sure. If there's more money, certainly it won't go out in fraud anymore. But we never bother to make sure. We never bother to hold folks accountable. We never bother to ensure that there is accountability. And in fact, at the time, it was funny. DHS told us over and over and over again in these different programs that they had internal audits, because of course at the time we were saying we need to audit these programs. We need to audit these programs. But DHS assured us, no, don't worry, we do internal audits. Well, guess what? The DHS internal audits found nothing. They did not find one incident of fraud. So forgive me if we don't trust the internal audits from DHS. They don't do the job. They don't actually dig in and find the problems. They don't. And instead of demanding that of our state agencies, instead of demanding that there is accountability with taxpayer funding, we're just going to dump more in. We do this over and over and over, and it's just not right. It's just not right. We are up to, with this bill, we're going to be up to about $1.5 billion spent this session. This bill's going to take us over that. $1.5 billion. We don't even have budget targets yet. These bills are not even part of our overall comprehensive state budget, and we've already spent $1.5 billion. We have not put a single provision in place to ensure that money is being spent where it needs to be spent. We have not put a single provision in place to ensure that folks that have committed fraud in the past are done doing so. Although, just a couple of weeks ago, 2 more folks were indicted. 2 more folks. Now, this was in relation to Feeding Our Future, but they were running child care centers 2 weeks ago. But by all means, let's just put more money in and more money in and more money in with no accountability. At some point, the taxpayers are going to be onto you. And they're going to see what you're doing. And they're going to see how irresponsible it is when, frankly, you've spent $1.5 billion already, and it's going to open their eyes when you get to the point where, sorry, there's no funds left. to take care of your Social Security taxes. There's no funds left to say, you know what, senior citizens, we should not be taxing you on your Social Security income. You know what? To our nursing home folks who really are in absolute crisis, in dire need, facilities are closing, I'm sorry, there's no money left. We've already spent it all. That's what we're doing. Instead of funding those programs that we track, we know need our help, we're dumping more and more money into programs that have proven fraudulent. They have proven documented fraud, and that's where we're going to dump our money instead. It's just wrong. It's just wrong. Fix your house before you keep dumping money into it. I implore members to vote no on this bill. As Representative Daniels suggested, at the very least, send it back to committee, fix it, put some measures in place to ensure that this money is not going to be spent in fraud.
I recognize the member from Hennepin, Representative Pryor.
Thank you, Mr. Speaker. Thank you. Got this in time. So I'm going to start because I'm just, Representative Franson has been taking us down memory lane, so I thought I would go there too at the beginning of my House speech right now. So even before she started her child care, I was taking my children to child care. And I was the only working person in our household. My husband was a student, and so I was the one income that was going to bring us forward. And so it's like, and so many mothers know what that's like when your family depends on you, and you gotta deliver that baby. And I have so much respect that you could continue to do childcare after just delivering. You are amazing for what you did, and I do have to acknowledge that. I don't think I could have done it. And so I had my 10 weeks, and then I had to have that, when we were in that period after birth and looking for a child care home, and we were choosing family child care. That was our preference. It just seemed to be right and closer to what I had grown up with in a two-parent home with a mother that stayed home with us. And it was so important to me who I was going to entrust my children to for the majority of their young lives. And then when we had the second one, and we're going through the same thing, and it's the family of 4 now and only 1 income. And it was that child care that we depended on. So one of the most important things that I will have ever done in my life is to be on the committee that talks about and tries to support our child care industry and be aware of these, support our children, our next generation of Minnesotans into their future lives. This will be the most important work that I have ever done and could ever imagine doing in my life. And when people said, what are your priorities? Top 3 priorities. One of them was always being able to fund child care assistance and early learning scholarships. I do group those together. So no matter, we've done great things, and we will continue to do great things, but for me, this has been and always will be the most important. And I have 90-year-old parents in assisted living, so I get there's other pressures on the budget, but this is for me what I will always care about, because we know child care is in a crisis. And I started this committee, when we started this committee, we were hearing about the crisis in child care. That was before the pandemic. And it's really simple to understand. Providers can't afford to do the job and charge any less than they are right now. Parents really can't afford it, especially parents that come from have low-wage jobs. And yet, there is no more important time in your life than those early years, when you're an infant and a toddler, those young kids, and I know that it's still important even when you're older than that. You need consistent quality care and learning. So the first bill we heard addresses that. This bill also addresses that. And let me get to the handout and just draw everybody's attention to this. The handout that you just got about what happened and what we found out about the fraud that was in our system. I was there when the OLA report came out. And fortunately, we had, I think, the right person at the right time to address the findings of that report. We had a prosecutor that said, how can we end this and make sure it doesn't happen again, that we catch it early and have a fix that works as a process, not as a statement on a TV show where you say, well, we fixed all this. No, but a process in place. And I remember when we heard the final bill that year, it was down in the basement of the state office building, which was not our regular meeting room or our regular time because it was at night. And I know that we accepted Republican amendments on that bill because the input from both the parties was so important to address what was happening and what had happened and to make sure it didn't happen again. So we came forward with a strong bill, which we'll see laid out as a reminder to folks that we did address it. We did it with working with our Republican colleagues at the time, and there was a bill that was put forward to address it. And I remember the amendment that Representative Franson put forward. We took half of the amendment because it was a good idea. Then the next session, when we came back together again, we said, DHS, how are you implementing this? And we had a hearing talking about the processes, and that's also on your sheet, the processes that DHS put into place, process improvement. Really, if you're in business, that is, the highest standards of always recognizing what your problem is and what you're trying to do, and always figuring out, is your process serving it? And all the checks and balances that were in place. So we had that hearing to make sure that we were addressing what had happened and to make sure that our taxpayer dollars are directed where we want them. Because money that goes to someone that's not serving our kids is money that should have been spent to serve our kids. So we have this discussion again, and you know what? We have our differences. But I know, and I will stand behind the work that our committee did. I will stand behind the work that GHS is doing to make sure that we have integrity in our system. All right, and now we get to the great work that we can do today. Again, look at your handouts. Kids can't wait. That's the one thing that we kept hearing over and over again in our committee. Kids can't wait. You can't park a kid for 3 weeks and say, well, we don't have quality care, we don't have consistent care for you right now, so just, I don't know what you're gonna do. Sorry, kid, you're on hold. We can't do anything for you. Kids can't wait. Every day an infant is in childcare is a day of their brain development. And if we are not addressing what their needs are, if they are not getting that quality care and learning, that stability in their lives, those are days that we can't get back. Those are days those children have missed. And what I want to come to is one of the biggest opportunity gaps that we have in Minnesota starts at this young age. We know that, as we have fallen behind other states in how we support our child care industry through these child care assistant payments, when we're down there at the bottom, at the 25th percentile, instead of where we should be at the 75th, which is what the federal government recommends, that means that kids have not been getting consistent quality care because the rates are not high enough to afford it. And you should be taking a look at our counties that support this, and I do want to highlight two from Minnesota Prenatal to 3 Coalition. One of their sentences and their conclusion is, when payment rates are too low, providers are less likely to serve families receiving child care assistance. When the rates are too low, providers are turning families away. So with this bill, when we improve these rates and bring them up to where the market is, we know that more families can get child care assistance that's quality and consistent because the providers can afford to take those kids. It's not that hard. All right, so who are we helping with this bill? We are helping working parents. Working parents. Those kids, we're helping those kids. We're helping the parents stay in the workforce. And the ones that are getting child care assistance, that are eligible for child care assistance, they are low-wage workers. But they're also the backbone of our workforce. And if we want to talk about nursing homes, one of the problems in nursing homes is they can't hire workers. One of the reasons they can't hire workers is because they're parents and they can't afford child care. So this is part of our economy, but it's helping the most at risk. It's helping our kids, our next generation of citizens in Minnesota when they most need it. And it's helping those families stay on the job and to know that their children, just like what I was looking for when I was a parent a long time ago, those kids are going to have a safe, nurturing place for their early care and learning. So thanks for bringing this bill.
I recognize the member from Crow Wing, Representative Heisman.
Thank you, Speaker. Members, I don't often speak to this subject area, but today I'm going to rise. And there's a couple of things that I think that need to be addressed yet that haven't been in this chamber. Representative Garofalo actually covered it in Ways and Means, but it really hasn't been brought up yet today. I think it is fair to say that this particular legislation is heavy on promises, especially when you listen to the rhetoric that's been being discussed in this chamber, and light on delivery. This problem with the CCAP program and fraud goes back quite a ways, and it's nice there has been some opportunity to address that mildly, I'll just say. But there's some serious problems yet still being discussed in this chamber, and amendments that were brought by Representative Daniels to try to bring some guardrails to this program are not allowed to move forward. Representative Garofalo brought up in the Ways and Means Committee the fact that there are still individuals receiving payments under the CCAP program that are currently under indictment, Chair Pinto. What's going on? And every time this issue is brought up, Representative Pinto, the answer is, well, it can be addressed by the agency. Why not allow amendments that could verify participation in that program to go on the bill? What are Democrats afraid of? I'm frustrated that we're still talking about this bill in the context of, well, that's something that we could work on. We've offered an opportunity to re-refer it back to committee. No, we can't do that. It's full steam ahead. Members, this bill is not ready. Not while there's still payments going to folks that are under indictment in the CCAP program. Members, vote no.
I recognize the member from Polk, Representative Keel.
Thank you, Mr. Speaker. I don't serve in child care, and it's been a little while since I've actually taken care of little ones, well, other than my grandchildren. But I'm a little concerned about this conversation about the fraud that doesn't get investigated. And I hear all the time we need more money for child care, which I can understand and appreciate the fact that it costs and costs a lot. But in my district, in the last year, I have had 3 child care providers that have wanted to get up and running. One was in a smaller town. The business owners said, hey, we'll get the building going. We found a child care provider. We'll do all the work that needs to be done to get the building ready. We'll fund it. We'll back it. But guess what? They waited and waited for approval. Waited for DHS to answer. I called often and said, what's going on? Oh, it's on a desk. We're looking at it shortly. But it took forever. And the businessmen look at me and go, if it wasn't for the issue of permitting with DHS, they would have been open 6 months at least earlier. What did they need? They had half of the approval. They were waiting for the fire marshal to come and approve it. It still took months. I would say the DHS needs to work on its efficiency to make sure that this is done. In Crookston, I have families, 41 spots. We just found out we are going to have infant care. It has taken them over a year. Business owner is in the district, but has one already in North Dakota, long time ago running. And now she's been having some Crookston people drive their children, that's at least 30 miles, over to the child care provider, dropped their children off, gone back to Crookston. So that's an hour, that's 60 minutes to drive over and back, and then they go to work, and of course, at the end of the day, the same thing happens. They have to go and get the children and bring them home. They're pretty excited because the open house is next week, and they will have that child care. Why did it take a year? Once again, the permits were hung up in DHS. And they know about this. I've called them. I've asked them. But I think there's more than money involved here. If we have clear messages between each other, because the providers know that they have to do certain things and the regulation. But this latest one took over a year, and it was set in a school setting that is open. They happen to have a couple of classrooms they're going to rent to the child care provider, and so much of the building is ready to go. It didn't take them much. But Representative Pinto, I think this is something that we have to address. Where is DHS with all of this? Why are they not making sure there is no fraud? Why are they not making sure that these permits are not being handled? I mean, when I call, it takes weeks to get a response. And certainly the people that I talk to are, we'll look for it, we'll check. We went back and forth, unbelievable times. And I just think there is more to this issue than funding. Funding is certainly important. It helps our young families out. But if we're dealing with fraud, it's really sad because we're taking away from those families. Fraud is taking away from children. It is taking away from those parents. And that needs to be addressed. So I can't vote for a bill that we don't know about the fraud yet. We need to check that first. Thank you, members.
I recognize the member from Hennepin, Representative Coulter.
Well, thank you, Mr. Speaker. You know, I'm pretty new around here. There are a lot of folks in this chamber that I don't know very well. And while at last count, I think I've been to 74 or 75 counties in the state of Minnesota, I certainly can't claim to know every district very well. But I'm willing to bet, Mr. Speaker, I am willing to bet that every single one of us has talked about childcare at least once in the last year. Maybe it's because you're like me and I see other members of the body and you're a parent of young kids struggling with trying to figure out how to make it all work with limited time, money, and especially energy. And in fact, one of the first conversations I had with Chair Lissegard was to tell him that I was going to have to miss a portion of property taxes almost every week so that I could run and pick up my daughter. Now, fortunately, my wife and I were able to make other arrangements so I don't have to do that. Maybe you've heard about it from local leaders and businesses, like I did at a recent chamber event, who know that lack of affordable, accessible childcare is a huge piece of the worker shortage. Maybe you've heard from providers in your community who love their jobs, but are finding it harder and harder to do them because they don't make enough to support themselves and their families, even as so many of us in this room right now over the last few years called them literal heroes. Representative Perez Vega called them warriors, which I really love. Whatever the context, it should be extremely clear to all of us that childcare is a center of life issue for every single person in this state. In fact, I believe that access to quality, affordable childcare is one of the greatest economic and social issues we face today. It undergirds almost everything we need or want to do. Now, it's disappointing to me that there are some here who either don't recognize how important this issue is, how center of life this is for so many of our constituents, or at least are just not committed to taking the steps needed to make a difference. We've heard specious attempts to link this bill to something else entirely. We've heard numbers thrown around that are charitably described as unsubstantiated, that were called, and I'm quoting, assumptions, conjecture, leaps of logic that had no basis at all by the individual who, for nearly 40 years, ran our nonpartisan office that investigates exactly these kinds of claims, even when the person making the claims was put under oath. Now, to be fair, there were some real flaws exposed that the legislature, in a bipartisan way, took steps and made investments to address, and that we continue to address in this bill. And I want to thank Chair Pinto for continuing to do this work. But now, though, we are essentially taking DHS to task for being unable to prove something for which there is no evidence doesn't exist. I know personally, I wouldn't be comfortable basing my vote on that kind of intellectual dishonesty and logical fallacy. And I don't know how I justify that to my constituents. Frankly, I'm not even sure I could justify that to my wife, though admittedly she's always been a pretty hard to persuade voter. Now, clearly there is bipartisan recognition of the need for more funding for our early care and education system in Minnesota. I am deeply grateful that Representatives Daniels and Hudson and Nelson and Zalesnikar all spoke powerfully to nearly $1 billion in new spending on early care and education in my bill just last week. And I will admit I'm a little uncomfortable with some of the praise that's been thrown its way this week, but there's still plenty of room for co-authors on House File 1277 if folks are interested. And with the full-on crisis that we face in childcare right now, and the systems and resources we have available to us, there is simply no good reason not to do this. Now, I think we should be extremely clear about what this bill does for ourselves and for the dozens of people watching at home. At its core, this is actually a pretty simple concept. Minnesotans help pay childcare providers to ensure that working families with lower incomes can still take care of their kids. How much we pay them, as has been said, is based on a market survey. And this is where I get really fired up. Because right now, our process is that we take that survey and essentially say to childcare providers, because you are caring for kids who already come from challenging circumstances, whose families, by definition, have less money, we want you to make less than 60 to 70% of your peers. This, in addition to the fact that child care providers are already among the most poorly paid professionals out there. From any perspective, does that make sense? If we were to ask our constituents, would they say that it does? This bill takes an initial step to ensure that child care providers, the workforce behind the workforce, aren't paid poverty wages to help some of our kids who need it the most. There is much more that we need to do to address the serious child care crisis we face, and there is more coming. And yes, I absolutely agree that there are needed changes to regulations. I agree that sometimes we do need to streamline and make just more common sense enforcement available. That is absolutely important. But to not support this bill, especially based on some of the arguments that our colleagues have laid out here, to me is just baffling. Supporting this bill shows Minnesotans that we are serious, that we are focused on doing the work that we were sent here to do. This is literally one of the issues I ran on because I have seen firsthand, and I see every single day, how center of life this issue is for folks in Bloomington and all over our state. If you agree that it is of critical importance to get every Minnesota kid off to a great start, I hope you'll join me by voting yes. Thank you.
I recognize the member from Mower, Representative Mueller.
Thank you, Mr. Speaker and members. I appreciate that last comment. Let's explain what this bill will do. Well, let me explain what this bill will not do. This bill will not follow the recommendations from the 2019 Child Care Task Force. The 2019 Child Care Task Force said that we as a legislature need to be looking at our regulations when it comes to inspections and licensing. Matter of fact, recommendation 2 from the 2019 Minnesota Task Force said, surveys reviewed by the task force show that the loss of thousands of licensed family child care providers over the last decade is predominantly due to the burdensome regulations, licensing inconsistencies, and increased paperwork. Providers have requested clear expectations, consistency, and fairness in enforcement of the rules and regulations in place to protect them. Members, this bill is continuing to give money that will not address the actual problem of price increase. This bill continues to give money to a system that has already been shown to be burdensome on our child care family providers. I too have talked to my child care family child care providers. We've had a meeting together. We've talked together. We have gone through the budget together. We've gone through the task force thing together. And we have looked at how we can help best provide for our family child care providers. And this is what they're asking for. And the task force said it, showed it, gave us recommendations on what we should be doing, explained in detail what legislators should be doing. It says the legislative action, legislation for full and abbreviated licensing review based on statistically significant key indicators that predict full compliance with all applicable rules and statutes. Development of a risk-based, data-driven tiered violation system with corresponding enforcement mechanisms that are appropriate to the risk presented by the violation. This bill doesn't address any of that. This bill doesn't address the actual root cause of why it's so expensive anyway. Yes, we have to have as many choices and as many possibilities for our families because that's what they want. They want to be able to decide which child care place that they can go to. And more are being pushed out, not because of the lack of money, but because of what government is doing to them by asking them to follow more and more regulations, more and more rules, and more burdensome compliance that the 2019 task force has told us that we need to roll back. Until we see a bill that tells us that we're going to actually look at regulations and change that, I ask members to vote red.
I recognize the member from Wright, Representative Hudson.
Thank you, Mr. Speaker. Where to begin? So we have assurances from DHS that everything's going to be okay. Last week, we had a joint committee meeting between Children and Families and Education Finance, where we were presented with a report from the Office of Legislative Auditor that concluded that their term was pervasive non-compliance with grant management policies. Pervasive noncompliance. Now, that's a term that we'll come back to here momentarily, but before we do, and by the way, just to link it to the assurances that we're getting from the agencies, the OLA was looking at and auditing DHS and MDE. So what we have here in this handout that was provided to us is assurance from the very same agency that the OLA just told us is in pervasive noncompliance, that everything's going to be okay. We got nothing to worry about. You'll forgive me for not taking that particularly seriously. I want to speak to some of the things that have been said by members in the majority tonight, particularly when it comes to playing on our emotions regarding the care of children and the people who provide it. Representative Pryor said that the goal here is to provide consistent quality care for children. Representative Perez Vega referred to child care providers and their employees as warriors, accused us of not valuing them, implied that we don't have their backs. Well, let me give you a couple examples of these warriors that we're talking about. The CCAP Investigations Unit Manager, Jay Swanson, indicated, amongst other things, that there was seized video during the investigation into the 2018 CCAP fraud. Seized video systems showing repeated situations of children not being supervised by the employees. Repeated situations of children not being supervised by the employees. These are your warriors. These are the folks whose backs we don't have. Maybe it's because they don't have ours. Maybe it's because they don't have the backs of our children. You want to argue over the amount of CCAP fraud from 2018? Okay, let's argue about it. First of all, let's take the assumption, again, pointing back to CCAP Investigations Unit Manager Jay Swanson. He indicated that fraud levels reached almost 50% of total CCAP expenditures, including both fraudulent billing and failing to provide the care and services required by law. In other words, people standing around not doing much, as was previously criticized. Jay Swanson thinks it's legitimate. He also expressed concerns with up to 100 child care centers billing the state $108 million in fiscal year 2017 alone. $108 million, that's his number. We've been conservative, just claiming 100. He says 50%, but even if you take our number of 100, that's 40%. That means 4 in 10 child care providers in 2018 were conducting themselves fraudulently. Now, let's accept, let's be generous. Let's accept that maybe we're wrong, maybe Jay Swanson is wrong. Maybe the investigators have looked into this and said that they generally agreed with the estimate of the extent and value of the fraud, that they too are wrong. And let's do a generous reduction of the estimate. Let's say it was only 50 million instead of 100 million. Well, that's still 20%. It means you can trust child care center to not be fraudulent by the narrow definition of fraud that is applied. You can trust that 8 out of 10 times. So you got a pretty decent chance. It's better than a coin flip. It's pretty good. But it still means that 2 times out of 10, we were throwing good money after bad to the tune of $50 million. Let's be generous again. Let's cut that in half. Let's say it was only 25 million, only 10%, only 1 out of 10. It's starting to look pretty good. 90%, that's an A, right? A minus. Doing all right. But this is the care of children that we're talking about here. Is 10% an acceptable failure rate when it comes to the care of children? When it comes to, because let's be clear about what we're talking about. We're talking about accepting payment. That's what fraud is, accepting payment for a service that you are not providing. And we're talking about people who we know were willing to do that. They were willing to take your money. They were willing to take your constituents' money under the auspices that they were going to care for children and then not actually do that. So even if we're extraordinarily generous and cut the estimate from 100 million down to 25, you're still talking about 10%. And we could do this all night. We'll cut it down to, we'll be really generous, 5%, 12.5 million. Now, 12.5 million is a lot of money. It's a lot of money to any Minnesotan. I don't care who you are. The idea that we would just let that go out the door, that we would erect a system that lets that money go out the door fraudulently to people who are acting in bad faith, to my mind, is unconscionable. And, I think all of this kind of misses the point, because if you're going to sit and debate over what the amount was it 100, was it 50, was it 25, was it 12.5, the fact that we're having the debate reveals the real point, which is here we are 5 years later and we don't know. How do we not know? How is it that we came through this process, through a deliberative process, how do we come up with a system that enabled any of these possibilities, let alone the $108 million that Jay Swanson says was fraud, out of $254 million? How's that possible? Well, I'll tell you how it's possible. It's because of that pervasive noncompliance that the OLA identified last week. What pervasive noncompliance means is that people aren't bothering to do their job. Representative Anu asked the question, why do we never bother to check? Well, I'll tell you why. It's real simple. Lack of incentive. Why would you want to know? Why would you care? Why would you want to find out? Where's the incentive? It's not your money. It's taxpayer money. You're only rocking the boat to turn over that rock and find out what lurks beneath it. There's no incentives in place for compliance with grant management practices. You know where there is incentive to assure quality? In the marketplace. We have this mechanism of price, and in children and families, and even offline, Chairman Pinto has an open invitation to me to engage with him on debate regarding economic theory, and I really do actually look forward to taking him up on that at some point. But I'll start it here, right? I'll start the opening salvo, and then we can work off of that later. And that is this, the argument as I understand it, the argument as it has been presented for why the state needs to interfere in this transaction, why the state needs to come between consumers and producers, between parents and their students and child care providers. The reason why we need to do that is because of this theory that there's a true cost, some ethereal true cost of child care that is not accurately reflected in market prices. And so our task is to make that true cost manifest and cover it by just throwing money at the system. And if that is indeed the theory, I'll at least grant you this much. This makes sense through the worldview of that theory. The idea that it doesn't matter how much money we throw at it. In fact, the more the merrier. We'll even let there be some fraud on the side. It doesn't really matter. It doesn't really apply, because what we're really getting after is trying to raise up the real value, the true value of the service beyond what price will give us. The problem with that is that price functions as quality control. If you remove the downward pressure on price, it's only going to keep going up. And that's what this is going to do. By going up to 75% from 40, by further subsidizing the price of childcare, you're only going to cause the overall price to go up. It'll be subsidized, it'll be spread across taxpayers, but we collectively are going to be paying more for it. And maybe that's the goal, I don't know. But it's certainly not worth pursuing careless, reckless policy that empowers folks to do things like this gal who ran SAFA Childcare in Bloomington. Nonprofit called Action for East African People claimed to feed 6,400 children. Claimed to. With one major problem: one of the food distribution sites didn't exist. Now that strikes me as a red flag, right? You say you got a distribution site, it's not there. I mean, it's in the physical world, right? So all you got to do to verify that it exists is drive by it, send somebody to it, take a look. We apparently didn't do that. According to the Minnesota Reformer, several of these sponsored sites were also the same locations for sites sponsored by other nonprofits reporting separate meal distribution operations from the same location. So multiple nonprofits saying that they're taking care of kids at a location that doesn't exist. It's a pretty big red flag. The individual who ran it, her name was Ms. Abakar, was also the CEO for a child care center, SAFA Child Care Center and Learning in Bloomington, which saw its license revoked in September of 2019 for providing false and misleading information and failure to comply with licensing laws and rules. In April of 2020, a new child care center popped up, Valley Learning Center, which was licensed to operate at the exact same address. Again, red flag. What's going on? Business CEO listed with that business with the Secretary of State was a known associate of Ms. Abukar, who had her corporate headquarters at the very same address for both her former and current child care center in Bloomington. So all of this stuff is, what this is indicative of is the brazenness. And we saw this, right? When we saw people get up who were perpetrators, who are under indictment, talk about what they were doing, there was no sense of shame. There was no sense of regret. I mean, we heard about some of the things that were done with this money, and more recently with the $250 million in Feeding Our Future fraud, going on vacations, buying houses. And again, these are people doing this under the auspices of feeding and caring for children. What kind of a person do you have to be to do that? Well, I'll tell you one thing, you're the kind of person who I don't want watching my kid. This bill doubles down on bad policies that have demonstrably negative results for taxpayers, for children, for parents. And I'll tell you, we have a model that works. Representative Coulter spoke to the bipartisan support of his bill, House File 1277, and children and families. Yeah, the reason why is because it was right in alignment with the amendment that I offered earlier today. Provided additional funding for early childhood scholarships. It reinforced, it leveraged that mechanism of price, the input of parents, their inherent ability to control quality because it's their kid and money that they have stewardship over. Those are powerful incentives that ensure you don't run into things like children not being supervised by the employees. Parent has to see that one time and they take their money and they go somewhere else. It's not going to happen to the tune of 5, 10, 20, 40%. This reminds me of our reading outcomes. 60 to 70% of children not able to read at grade level. And, we're going to hear bills coming down the pike to just pour more money into that system, too. Failure should be an indicator of course correction. But for some reason, once you get the government involved, it's often rewarded. And that's what we're doing here today. Vote no, please.
I recognize the member from Hennepin, Representative Katiza Watoon.
Speaker, this may be dating myself, but my favorite Christmas movie is Miracle on 34th Street. Not the original, but the 1994 version. If you haven't seen it, the basic plot is that a department store in New York has hired a Santa Claus, who the audience learns is the real Santa Claus. But a rival department store stages an attack on him and takes him to court, asking him to prove that he is the real Santa Claus. but they are equally unable to prove that he isn't the real Santa Claus. Now, members, this is a lot like the wild accusations of fraud back in the day before a number of us were even serving in the legislature, before Chair Pinto's Early Childhood Finance and Policy Committee took active steps, bipartisan action with our colleagues in the House, the Republican Senate to address program integrity. Representative Pryor detailed the handout from DHS on many of the changes that we have implemented over the past 4 years. You've asked us to prove that $100 million of fraud didn't occur, but you have no proof that anywhere near that amount occurred. And meanwhile, you're reading off a bunch of examples of how DHS shut down fraudulent providers in order to prove that our program integrity measures don't work? That's weird. We've taken bipartisan action to address this, and this bill includes additional action to address this. It is detrimental to the children and families and small businesses of Minnesota to continue starving a program of critical resources when 99% of people are doing the right thing, and 1% might not be. We're not okay with that. That's why we can continue to improve integrity and oversight, and we can continue to move forward with much needed investment in this program. Members, here are some of the states that currently have higher reimbursement rates than Minnesota: South Dakota, North Dakota, Iowa, Wisconsin. We hear a lot about people moving over the border from our friends on the other side of the aisle. Maybe that's where some of our child care providers are going, because they're actually getting paid what they are worth, or closer to it. Alabama, Arkansas, Florida, Louisiana, West Virginia, and the list goes on. Members, research shows us time and time again that there is no better return on investment than early care and learning. Some studies show upwards of a 16-to-1 return. So members, if you're concerned about the best use of taxpayer dollars, if you're concerned about workforce shortages, if you're concerned about the future of our state, vote green.
I recognize the member from Rice, Representative Daniels.
Thank you, Mr. Speaker and members. Well, this has been a lively debate. I won't go over all the points that were made. Thank you, Representative Hudson, for bringing to light all the deficiencies in the program, all the intentional fraud that's there. When we were talking to the Inspector General in committee, I asked her what that amount was that they suspected of fraud, and I never got a dollar amount. And then at that time in committee, we asked how many ongoing investigations. We never got an answer for that either. But she did email me a couple of hours later and said there was 40 ongoing investigations. So this isn't over. On January 17th, the Children and Families Committee was given a very rosy review of the success of the program integrity measures adopted in 2019. This left the impression that those measures were working to prohibit fraud and abuse. On February 6th, the Ways and Means Committee added a new integrity measure to the bill that were not heard or discussed in Children and Families Committee. Now, that confirms our suspicions that those measures have failed and fraud continues to be pervasive. I could go on and on with all the stories, but I think everybody's heard them for years now. Since 2017, this has been going on. So, Chair Pinto, my hat's off to you. I like working with you. I know you have a good heart, but with meaningful fraud and fraud measures, this bill will simply help to fully fund fraud. So members, with a regretful heart, I ask you to vote no. Thank you.
The member from Stearns, Representative Demuth.
Thank you, Speaker Hortman and members. As we've heard in this chamber a little bit, people have kind of taken us down memory lane. I'm just going to do that briefly, just for one more minute here. I want to take you back to 2018 when the Child Care Assistance Program, also known as CCAP, was rocked by the allegations of fraud exceeding $100 million. While the full extent of the fraud was never itemized or determined, fraud investigators working with the Department of Human Services did agree that there was $100 million, and that was an accurate assessment. Unfortunately, we will never know the true scope of the cost of fraud. What we know for a fact, though, is fraud is real and is more pervasive than the agency would ever admit or could determine. So while downplaying the reality of fraud in the program, the majority in 2019 passed several program integrity measures to plug the leaking holes and try to restore taxpayer confidence. As recently as January 17th of this year, the Inspector General gave an assessment of the success of those measures and expressed confidence that the prevalent cases of fraud were a problem of the past. This confidence in the program integrity was echoed by the chair of Children and Families Committee. But unfortunately, the reality is becoming too obvious to ignore, as the massive Feeding Our Future scam had obvious overlaps into the CCAP and other DHS-managed programs. Despite the public assurances of those measures adopted in 2019, if they were working, on February 6th, in the Committee on Ways and Means, an amendment adding more integrity measures suddenly appeared out of nowhere, just one day before the Star Tribune would report on February 7th that DHS has revoked the licenses for 2 adult daycare centers, controlled by individuals involved and indicted in the Feeding Our Future scam. We will assume that that was just a coincidence, that the majority didn't have prior knowledge of the breaking news. But too often the majority response to fraud is to deny or downplay the problem or simply explain it away as harmless bookkeeping errors. By lumping waste, fraud, and abuse together with the DFL, the DFL implies that mismanaging taxpayer funds is the same as schemes to steal taxpayer funds. So why does fraud and abuse matter? Why should we care about $100 million here, $250 million there? Because as unbelievable as these figures sound, the true scope of fraud is exponentially worse. So I served as a member of the Early Childhood Committee for 4 years, and we often heard that there is an expected return on investment for the funds that we are able to put forward for early care and learning of children. In the committee, we often hear that it can range from 8% to 13%. However, the return on investment does cut both ways, and money not gained is also money lost. Let's use a conservative rate of return. So that $100 million in fraud and abuse is already worth more than $150 million. And over the next 50 years, the long-term costs of CCAP fraud could be more than $5 billion. I'll say that again. That is $5 billion in stolen opportunities for children and future costs for taxpayers. And that $250 million stolen by Feeding Our Future is a long-term loss of more than $12 billion. So combine those two, that's more than $17 billion, almost the size of our current surplus, in future dividends lost and added costs to be carried by current and future taxpayers. This session, we also learned that the majority believes there is a magic money tree. Unfortunately, they are right, but it is a money tree of fraud. Under failed leadership and lax oversight, Feeding Our Future had a magic money tree worth more than $250 million. And those willing to steal money intended to provide care or food to children and vulnerable adults still have that magic money tree of fraud. But neither the taxpayers nor honest business owners have a money tree. They just have a higher tax bill. We hear that money always flows faster than investigation and bureaucracy. So members, it is time to stop fully funding fraud and take meaningful measures to protect taxpayers and the children who rely on effective programs serving their best interests. So members, until we actually get serious about the issue of fraud, vote no.
The member from Hennepin, Representative Long.
Thank you, Madam Speaker. I'm learning that there is a bit of a theme this session in some of our floor debates, which is that if we can't fix the entire problem all at once, we shouldn't fix part of it. And if that was our standard, then no bill could ever meet it, and why would we bother showing up for work? We know that affordable child care is an issue all over the state. We've heard from colleagues on both sides of the aisle today that this is important and that this is something we need to address. We know that the cost of child care in Minnesota is among the most expensive in the nation. It is as expensive to send a child to child care on average in the state of Minnesota as it is first-year tuition at the University of Minnesota. We know that this is a top reason for our workforce shortage and that we need to provide more affordable child care so that people can get back to work. At our first presser on the first budget rollout and our first event as leaders, Leader Damon said that child care was a bipartisan issue and something that we wanted to work on together. We know this is a problem. We know this is something where we should be able to work together and address it on a bipartisan basis. This bill is really straightforward. It increases the reimbursement for CCAP, for one of our great programs that is providing access for low-income Minnesotans to child care, to the federal guidelines. That's it. If the payment is too low, providers are less likely to serve families who are on this program. This is about access for low-income families. This is about living wages for child care providers. This is about helping child care centers stay open. My 4-year-old loves her pre-K teachers. Boy, is she learning a lot from them. She comes home every day and tells me about what she did, how excited she was. She's always excited to go back to pre-K. But boy, are her teachers underpaid. They deserve a heck of a lot more than they are getting right now, as do all of our child care and early childhood teachers in the state. Hopefully there is no disagreement in this chamber on that point, that we should be paying these hardworking individuals more money. Only 12 states have worse rates for infant care than Minnesota does. So hopefully we can all agree that moving our CCAP reimbursement rates to match the federal guidelines is something we should all do. So then let's set that aside. If this is just about fraud, if you care about fraud, well then guess what? Since 2018, when a lot of the data was being cited, we took significant action in 2019. That seems to all have been wiped away or forgotten. But set that aside. This bill itself is expanding the tools that DHS has to deal with fraud. It authorizes the DHS to cut off when there are credible allegations of fraud. These are new tools that we will be providing to DHS to deal with fraud. So if you care about fraud and you want to take significant action, then you should be voting for this bill. We also were willing to work together on the amendments that were authored by the minority. We often hear, you're not willing to take our amendments. Well, guess what? We were willing to take them today with some very minor amendments, but they were withdrawn. At some point, you have to wonder if it's better to keep the talking point alive or if we really want to work together to address this problem. This bill is about the lack of affordable childcare that is holding parents back from working, holding businesses back from hiring, and holding kids back from getting a great start to live. So let's vote green to support our child care providers, families, and most importantly, our kids. Thank you, Madam Speaker.
The member from Ramsey, the author of the bill, Representative Pinto.
Thank you, Madam Speaker. Thank you, members. Thank you, Leader Long, for that great summary, I think, of where things stand. I think I've learned in the last couple of hours that debate on the House floor, maybe I should have known this, does not actually need to be tethered to fact or to reality. Members, I'll take a little journey down memory lane. The 2019 OLA report, we've heard this number of $100 million. Quote, we did not find evidence to substantiate the allegation of that level of fraud. The OLA report found that 4 years ago. So what did we do? We passed, as Leader Long said, a series of reforms to the program distributed to everybody in this chamber. Multiple changes. This bill, as Leader Long just said, contains a series of provisions. I didn't walk through them so much at the beginning because I kind of thought we'd get into them in more detail. I think Leader Long summarized them quite well. By voting for this bill, when you do that, you will be voting to give DHS additional authority to cut off fraudsters. If you vote against this bill, you are voting against additional authority for DHS to cut off fraudsters, people committing fraud in other state programs, in federal programs. That is the question before you. That is the opportunity in HF 13. It's ironic, I have to say, members, I often hear this from members of the minority. I heard this in discussion today. Even as we talk all about this, we also complain the regulations are too burdensome. Too burdensome on the one hand, and then on the other hand, we need to have more regulations. And I struggle with this. I hope members remember that right now, there is regulation reform efforts going on that we have funded, working with family child care providers, child care centers. But we have to ultimately make a decision about where we stand and decide, are we in fact going to take these issues seriously? Are we going to provide the opportunity to, as was said at one point, we're just letting money go out the door. I think I heard somebody say that. If you feel that way, you will vote green, because this gives power to stop that. What is the evidence that DHS will in fact exercise the authority? Your own list of DHS exercising that authority. I think what bothers me the most, though, in all this is that the true threat to the integrity of the CCAP program is our failure to actually do what we're supposed to do with the CCAP program. You heard Representative Katizo-Toon say this. All the states around us have higher rates than we do. They're actually compensating the people who do this critical work in the way that they actually should be compensated. It is time for Minnesota to join them. It is time to pass this bill for kids, for families, for whatever concerns that you may have for program integrity. Let's vote green. Let's make it happen. Thank you.
The clerk will take the roll on the bill. Will the clerk please call the name of the member who is voting remotely?
Agbaje.
Okay, here you go.
Agbaje votes yes.
Agbaje votes aye.
The clerk will close the roll. There being 69 ayes and 59 nays, the bill is passed and its title agreed to.